The COVIDSurg Collaborative is an international research network. Today, COVIDSurg has published its latest study in the British Journal of Surgery. This study looks at the benefits of preoperative vaccination in elective surgery patients. Joanna, can you tell me why this study was done?
Yes, so this study was done by the COVIDSurg Collaborative. We've delivered as a collaborative network 3 studies in the last year. And one of our previous studies identified that patients undergoing surgery are at high risk of mortality if they have a perioperative SARS-CoV-2 infection. So overall, we've included in our studies around 190,000 patients, and this study addressed the question, can surgical patients be protected from those worse outcomes if they have a vaccine before surgery?
Okay, that's very interesting. And what were the key findings, Joanna?
So we found that vaccination can significantly reduce postoperative mortality in elective surgery. And we also know that we need to vaccinate fewer surgical patients compared to the general population to save one life. This means that with the same number of vaccines, we can save more lives if we prioritize preoperative vaccination in surgical patients.
Thank you, Joanna. And the study actually shows that the greatest benefit from preoperative vaccination is in patients aged 70 years and over having cancer surgery. In fact, whereas 1,840 people in the general population would need to be vaccinated to save a life, only 351 patients aged 70 years and over having cancer surgery would need to be vaccinated to save a life. So these are really important findings. But Anil, can you tell us about how we can put these findings into practice?
Surgeons and surgical teams need to look at the vaccination pathways around them. So, for example, if vaccinations are done in vaccination centres, they need to work through the hospital management and the vaccination centre director. Equally, if it's done at the hospital, they need to speak to the director of that process and again, find the group of patients that they want to start with. Now, in most countries, there is limited access to vaccination. So this study quite clearly identifies who the priority groups would be. I would start with patients over the age of 70 undergoing cancer surgery as initial focus, for example.
Thank you. And what do you think is the role of governments in terms of adopting these findings?
The governments are balancing the needs of whole populations, and each government is addressing that slightly differently. However, this shows an at-need group that is generally supportable by the public. So patients undergoing cancer surgery, which can't wait, which has risks, and especially affects older people. Most members of the public would accept that as being a priority. So what our paper allows governments and policymakers and surgical associations to do is to use real data to set guidance and policy. We're not just basing these recommendations on our feelings, they are based on factual data. And so that data can be used to create guidance and policy change. And I would encourage surgeons to work with their surgical associations to create guidance. And then the surgical associations can feed that data up to policymakers.
Okay, thank you, Anil. A final question for Joanna. Arising from this study, what are the questions for future research? Is there anything we need more data on?
So we definitely know that it's worth vaccinating surgical patients. What we don't know from this study is how many doses of the vaccine do they need to actually be protected, and for how long should we wait after the vaccine to actually operate the patients. So those are questions for future studies.